Hello, my name is Jennifer Cowger. I am the section head of the Advanced Heart Failure Program here at Henry Ford and the medical director of the LVAD program. I wanted to reach out to our Heartmate 2 and Heartmate 3 patients because you will be receiving a letter in the coming days discussing an FDA recall regarding the Heartmate 2 and Heartmate 3 device. And I wanted to reach out personally and discuss what this recall means. So first of all, what does the recall entail? What the FDA has found is that in some patients on Heartmate support, the outflow graft, which is the tube that comes off of your heart pump, begins to get narrowed. Think of it like a kink or a clogging of the pipe. And what this does is it prevents blood from going from your pump out the tube to your aorta, which is where it goes to the rest of the body. This prevents your pump, when it is severely blocked, from delivering normal blood flow to your organs. So what can happen when there is a severe blockage is you can develop recurrent heart failure symptoms, shortness of breath, dizziness, swelling, and this typically comes on slowly over time. What is very, very important to hear is that this is not a common complication. Of over 15,000 Heartmate 2 and Heartmate 3 LVADs implanted to date, there have been 273 reported injuries, meaning device outflow graft obstruction that has led to signs or symptoms that are severe enough to warrant intervention. Of over 15,000 devices implanted, there have been 14 deaths attributed to this to date. And what the estimate is that the likelihood of a severe blockage warranting intervention is less than 2% at 5 years. So what does that mean? That means if I have 100 patients on Heartmate 2 or Heartmate 3 support for 5 years, less than 2 of them at 5 years will have a severe blockage. However, our team is going to be vigilant because we want to monitor all of our patients for signs and symptoms of outflow graft dysfunction. So what will we do to ensure you're safe? Each time you're at clinic, we will download your device logs and we will send those to Abbott. And what they're going to do is they're going to be able to monitor your flow over time to make sure that the function of your pump remains stable and correct. We will be fully responsive, as always, to any calls about low flow alarms or symptoms of heart failure. The most common sign associated with an outflow graft dysfunction is recurrent and persistent LVAD alarms and a progressive drop in LVAD flows. Now, I say recurrent and persistent because that doesn't mean that a single or isolated alarm means that your outflow graft is blocked. It is much more common that it's related to something else like dehydration or high blood pressure. But if you have persistent and recurrent low flow alarms and we're starting to see your flows on your pump drop, then we will do additional testing to be sure that you're safe. At Henry Ford, we are committed to keeping you safe. We are committed to watching you and to ensure that you have success on pump support. What is important to know is that this recall does not mean that the pump is being taken off the market, and it does not mean that the average patient would need a surgery to replace the pump. Survival on Heartmate 3 support now in the United States is well over 5 years. That is longer than any pump out on the market. People are living longer, not shorter, and it is the best device that we've had in our history of devices. So rest assured that you're on a safe pump. You're on the best pump out there, and that we will work with you to keep you safe on LVAD support. Importantly, if you are having any alarms, signs or symptoms, or just any general concerns, you know that we are on call 24/7. Please do not hesitate to reach out. Please page our VAD coordinator at 313-705-8255. 0089, and we will be happy to address any of your concerns. Thank you.